This is a super simple surgery checklist that you can use if you plan to get cosmetic surgery, specifically lipo, tummy tuck, and BBL surgery. Now, I'm just going to run straight through the list. Some things I may elaborate on, but for the most part, they're self-explanatory. So we're just going to get right to it because ain't nobody got time to waste. The first thing you want to do, which is the most important, is decide what your goal weight is going to be. Your goal weight is very important because then you can start planning what you feel as though needs to be done in order for you to achieve that weight. The next thing is your goal date. If you are serious about getting surgery, you definitely want to put a date on it because if you add a date, that just makes it more serious. Have realistic expectations of what you think the outcome is going to be. Being realistic is so important because that can be one of the first steps in getting your heart broke. Like if you're comparing yourself to someone who you do not currently have a similar physique to, you may end up letting yourself down when the outcome isn't what you assume that it would be based on your visual. Like what you visually see and like, you may not be able to get. So just keep that in mind. You want to be mentally prepared for the experience, not only the surgery, but after the surgery, the things you're going to see, how you're going to feel. Know that you're getting ready to make a change to yourself that's going to affect you mentally. Change your eating habits. You want to change your eating habits, especially if your plan is to lose weight and maintain it, because you don't want to go into your new body having bad eating habits because your old body is going to come right back, or it'll come back faster than you expected if you still maintain a poor diet after receiving your surgery and obtaining your goal body. You also want to maintain some form of workout schedule because you're not going to be able to work out after the surgery, but you do want to get in the habit of working out and get your body used to it so you know what to expect after you have your surgery. Now, to the girls who are going to work out first and lose a little bit of weight first, which is always recommended, once you lose some weight, you can definitely pinpoint exactly what needs to be done. Like if you feel like you want the excess skin removed from your stomach, or you feel like you just need lipo, those things can be determined after you lose your desired amount of weight. And once you get to this point, you want to decide what services do you actually want to have done. And you must remain firm on these things because when you go into a doctor's office or you're going to get cosmetic surgery, their job is to upsell. So if they can convince you into getting more than one service or convince you into getting something that you really don't want, they will do it. And then you will end up going back to get the thing that you actually did want. So make sure that you're firm and that you remain serious about how you want your body to look and what services you want done. Because they are professionals, but they are also selling you a product. So keep that in mind. Most people go off of pictures, before and after pictures that they've seen of doctors' work, and they'll go from there. But I always say, look for women who have a similar stature to you and go for that doctor. Go with a doctor that is familiar with working with your body type. And even after you see their work, you still want to research them and make sure that it is a safe and clean place to go. Once you decide on a doctor, you want to develop your financial plan. Like if you're going to finance through them, if you're going to do care credit, if you're going to pay out of pocket. This is very important because how are you going to get the surgery? Once you have your funds secured, you can contact a doctor of your choice and see if they will be the best fit. Now, just because you like the doctor and you like their work, you still have to contact them just to see how comfortable you will be with this person and working with them. If you feel uneasy about how the doctor is talking, how they're treating you, you may want to continue to research and find somebody else. Find out what you will need for the surgeries that you're getting so you can make sure that you have it. Decide whether you will be staying in a recovery house, hire a private nurse, or have a loved one help you post-surgery. One of these is free, but it may end up costing you in the long run, so be wise when choosing what you're going to do for your aftercare. Have comfy and easy to wear clothes for after surgery. This includes muumuus and easy free-flowing dresses. This will give you easier access to your undergarments, and it'll make bathroom trips easier. Have aftercare money, because you will be hit with some surprise expenses that you didn't know you were going to have after you have the surgery. You want to have money for your undergarments. You want to have money for your massages. You want to have money for skincare products, for bandages, and everything you might need post-surgery. Your aftercare is just as important as the doctor that you choose, because a lot of the things that can occur after the surgery is done, if you are not properly tended to, you will run into some issues. Find out about self-massages that you can do to maintain your surgery beyond post-op massages. And you also want to be aware of scar care so that you can take care of your skin while it's healing. This is a basic checklist that you can prioritize these checklist items in the order that best suits you. Hopefully this helps someone. And feel free to add your checklist items in the comment section.